Thanks so much. Hello, everyone, and a warm welcome to our Fireside Chat, Quo Vadis Global Health. My name is Tanya. I work at DSW in the area of global health, and DSW is also a member of Action Against AIDS. And we are very excited today to have you with us for this interesting and insightful discussion, because today we are focusing on the Global Fund's role in responding to emergencies and its contribution to building health resilience around the world. And as many of you know, the rolling Global Fund replenishment is currently underway, so it's a crucial moment. However, it's important to clarify beforehand the Global Fund approach to emergencies, whether it's caused by conflict, natural disasters, or climate-related shocks. It's not a response to the current financial crisis or the funding gaps in global health. The emergency response strengthens resilience and ensures continuity of care, even in the most challenging settings and environments. And in just a few moments, we will hear more on that from Francesco, our colleague from the Global Fund, who will walk us through the emergency response approach. And before we dive into the discussion, I have just a few housekeeping points that will help us to run the session smoothly today. So first, as you know, this is a fireside chat format, so we're aiming for an open and constructive conversation. Then for your info, this session is being recorded and will be made available afterwards. And as you already noticed, the language of this session is English, so unfortunately there's no translation available today. Then another point, please make sure to keep your cameras and your microphones switched off during the discussion to avoid any background noises or or distractions. So, and in the end, we would like to take a group screenshot. So then please feel free to turn on your cameras briefly if you would like to be included in that photo. And now, without further ado, I'd like to hand over to our wonderful moderators who will be guiding us through this session today. So over to Johanna and Sasha. Thank you.
Yes, good morning, everybody. My name is Sasha Gurinova. I'm working for Deutsche AIDS-Hilfe. We are based in Germany, in Berlin, and we are a non-profit association of member organizations all over Germany, and we are working on HIV prevention among key population. My role at the Deutsche AIDS-Hilfe is to lead international project. I'm also responsible for international cooperation and collaboration. And our main focus is the region, Eastern Europe, Central Asia, and Caucasus. Over to you, Johanna.
Thank you. So good morning, good afternoon, or good evening, wherever you are joining us from. A very warm welcome from my side as well. My name is Johanna, and I work for Action Against AIDS Germany. And it's my pleasure to welcome you all and to introduce our three great panelists and speakers for today. So first, we have Francesco Moschetta, Manager of the Implementation and Challenging Operation Environment Team at the Global Fund. Welcome. Second, we have Said Arif Hussein, Project Coordinator at the International Organization for Migration, IOM. He oversees a Global Fund grant project called the Middle East Response, which is implemented across 7 countries in the MENA region. Very warm welcome to you, Arif. And finally, we have Akramul Islam, Senior Director of Health and Humanitarian Crisis Management at BRAC, an international development organization in Bangladesh. Welcome, Akramul. So to set the scene for today's session, I'll now hand over to Sasha.
Thank you, Johanna. Dear Francesco Moschetta, you are the manager of the Implementation and Challenging Operating Environment team at the Global Fund. Before we move to our discussion with examples from Middle East and Bangladesh, we would like to invite you to briefly present how the Global Fund responds to emergencies. Could you please tell us how the Global Fund ensures the continuity and effectiveness of its work in the challenging operating environments? And what key challenges you face in your day-to-day work? Also, how does the Global Fund collaborate at country level with partner organizations during crises? And finally, Francesca, how many additional resources are invested to safeguard essential health services during times of disruptions and disease outbreaks? You will have 10 minutes, Francesca, please. The floor is yours.
Thank you very much, Sasha and Joanna, but also thanks for inviting me and welcome to the people online. Yes, my name is Francesco, and I've been with the Global Fund for a number of years, 13 actually. But before I used to work in the humanitarian settings, and especially in the refugee settings and IDPs. So I'm quite familiar with the emergencies and the complexities. Maybe it's also good for the people online to remind that the Global Fund is a partnership-based organization, so it is a financial institution. We believe in country ownership and country leadership. Those are the models that we've been promoting and focus on. But as you said, and as a part of the call, unfortunately, the environment is changing a lot. The conflicts are increasing displacement of our populations as well, more migrants, more refugees. And in addition to this, we have the climate change related events that is actually creating an additional level of stress and forcing people to move and creating an additional sort of a burden on the health systems. With these changing world and evolving situations, the Global Fund cannot be static. It has to be very dynamic. And this has been a part of the reflections and as a sort of a financial institution, had to face to address the people living in any conditions in any area of the country. We care about fighting HIV, TB, and malaria. We cannot do it without looking into areas that are not accessible, situations of emergency. We cannot afford actually having or leaving anyone behind. This is really the core of a Global Fund mandate. And with this in mind, we couldn't stop. So when there's a crisis in a country, there's a coup d'etat, there's a change of a regime, when there's an influx of the refugees, we cannot stop. We need to find a way to adapt. We need to find a way to reach the population. We need to find a way to engage with different stakeholders. This has been the mindset change for the Global Fund. It has been exploring over the past, I would probably say, 15 years, the way to engage in the different settings. The response to crisis, we're not an emergency donor. We're not an emergency organization. We're still a development organization that focuses on HIV, TB, and malaria. This is our mandate. But as I said, we work in any settings, including a time of a crisis. We have an example from IOM in the Middle East response, but also from BRAC in the Bangladesh. We cannot just stop, but we have to find a different way. And as you mentioned, this way ranges from a different sort of a mechanism. On one side, we are funding organizations, so we need to be very agile in the way we are financing or using existing funding. So we try to encourage the way we reprogram funding at country level very quickly to be able to respond to different sort of a crisis and situations. So we had an example of Ukraine in the past, but also Pakistan, where there was a different sort of a type of a situation. So we encourage the PRs at country level, the principal recipients, to reprogram existing funding to address the changing situations. We cannot be very rigid in the way we are implementing activities, so we need to be flexible and agile to respond to crisis. And we approved those flexibilities to be able to respond, which is not really normal for an organization like a Global Fund that is a very sort of a development. It takes years to approve a grant. It takes years to validate. In those settings, it takes about weeks to approve decisions. This is very key for a financial organization because often funding are available in a country, but if you're imaging an influx of refugees in a given settings, the whole sort of implementation and prioritization of interventions at country level will have to be relooked at. We have a policy that's been approved back in 2016. It's called the Challenging Operating Environment Policy. And that is a Global Fund definition to say in any settings that is quite challenging due to different reasons, ranging from a conflict, influx of refugees, internal displacement populations, or any type of other events, we can provide some sort of a framework of flexibilities and adaptability to the country context. I'm insisting it because it is being applied in a number of settings, ranging from implementing activities in the northern part of Mali, where we don't work with the government, but we work with the civil society in that part of the country to reach a population existing there, into responding to situations in Afghanistan, in responding to situations within the portfolio of Ukraine, in the existing context, the same for northern part of Mozambique. So we have these policies that provide the country teams and the Global Fund with a range of options to implement activities. The model of a Global Fund, as I explained at the beginning, is a very traditional country-based and country-driven. In those settings, we need to be able to engage with the different stakeholders. We need to be able to introduce a different way to work, type of a contract and modalities. We need to have a different sort of a risk trade-off. And the Global Fund has been able to develop those risk trade-off, which is really country-specific. We don't have a one model applicable to all those settings because we have situations like Haiti. There's a changing regularly. We have a different type of emergencies being faced at that sort of a country, and we need to be able to adapt quickly in those settings. We are based in Geneva as an organization. The only way the Global Fund has been learning how to intervene in those settings is by engaging with partners at country level. And when I say partners, I'm talking about additional and different partners. IUM is one of those examples. We've been engaging a lot with IUM also to understand how to address the needs around the migrant population, but also how to respond to crisis. But it's not only. We've been working with UNHCR in a number of the settings where the refugees population is quite large. We need to know how to engage with the refugees, how to work in refugee settings, in urban settings, how to address the certain needs of the population on the move. This has been a learning process. We've been engaged also for IDPs at country level with a cluster system, which is coordinated by OCHA on the humanitarian cluster, by WHO for health cluster. For an organization like the Global Fund, again, which are very traditional sort of development focus, having to work in those settings, we had to learn from other partners. We need to be able to engage them. We do at country level through the country coordination mechanism, but also globally by participating into a number of forums and exchange with those partners. In a number of years, also the partnership with the MSF, Médecins Sans Frontières, which is really by extreme humanitarian sort of organizations, have been growing because we work in the same settings. We want to focus to the same people living with HIV, and we find a way to work together in those settings. So partnership has been very essential. And as you mentioned, in certain settings, we might not have enough funding also available at the country level. We need to mobilize an additional funding. And back in 2014, we established what we call it emergency funding. Again, emergency funding is for Global Fund, sort of the language in the sense that is within our mandate. So we don't respond to the emergency per se, but we focus on how to support countries to respond to HIV, TB, and malaria in emergency settings. But it was quite a success story, relatively innovative for a development organization or development-focused organization, because we are able to mobilize quickly extra funding to support the response at country level. From the creation of the emergency funding, we have been disbursing nearly 150 million. And those additional funding are actually on top of existing grants. So that means that we are catalyzing also the use of existing fund plus the emergency funding at the country level. We have some example with the Ukraine, where we mobilize nearly 25 million, or in addition of the 36 million that have been mobilized within the same portfolio. We've been supporting Bangladesh, and our colleagues from BRAC can actually also provide some information about this. So we have been supporting Afghanistan when there's been taken over by the Taliban regime, and there's been a lot of a freeze from different donors. The Global Fund remained in the country, and we also support additional funding to the Sahatmandi model, which is actually supporting the system. So basically, the emergency funding has been always the last resort tool to support those situations where, for different reasons, you had to mobilize additional resources and funding. The last point I wanted to mention is actually that traditionally, the Global Fund does not really stop with their own eligibility criteria. We were able also in the past to support countries like Venezuela that was not eligible of that country by mobilizing extra resources through the board agreement. So this is a bit of the range of how the Global Fund over the past year, through the policy, through different internal mechanisms, through the partnership engagement, has been learning a lot. What we consider ourselves the challenging operating environments, and then many of you might be familiar, represented nearly 40% of the global fund allocation. But not only, it's also hosting a number of refugees or hosting IDPs. So we're talking about portfolios that require some sort of a special attention. And only with the engagement with the civil society and partners at the country level, and different partners, we know the traditional ones, we're able to understand the context and adapt the global fund model to the country needs, and also able to reach populations in areas that are not usually very accessible. And I will pause there. Thanks, Sasha.
Thank you so much, Francesca. I think for us here, it is important that you notice that Global Fund is not a rigid structure, that you're flexible, and it's crucial that you're looking at the different settings and areas that are not accessible. Thank you very much. And I think we are all very thankful for mobilizing additional funds. And I think I hope that governments are also acknowledge this and will continue to provide funds to Global Fund for its important work. We will have chance to hear from Francesca more during today's talk, but now I will hand over to Johanna to introduce other speakers. Thank you again, Francesca.
Thank you, Sasha. Thank you, Francesco. So now we will start a first round of discussion where we invite our speakers from Jordan and Bangladesh to describe the situation in their countries and regions. And in a second round, we will focus on the Global Fund's strategic approach in response to emergency and its impact. But let me start with the first round and with Arif Hussein from Jordan. So, dear Arif, you work for IOM in Jordan, and you are managing the Global Fund grant project named Middle East Response that is implemented in 7 countries. The Global Fund is one of the strategic partners in the region, and the Middle East is very often in the news due to conflict, especially, and is certainly a challenging environment for implementing and sustaining health-related programs. Could you please illustrate the situation in your region and talk about programs that exist to respond to emergencies? Arif, over to you.
Thank you very much, Johanna, and good morning and assalamu alaikum to everyone on the call. Thanks for this introduction. Actually, the little informing more, I'm Arif Hussain, and as Johanna informed, I'm managing as the Senior Regional Project Coordinator for the MER Global Fund project. I also would take this opportunity to thank the organizer for providing me this opportunity to speak on behalf of the MER Global Fund project. I'm sure many of us are aware the Middle East has been actually a region marked by political instability, protracted crisis, and open conflicts for quite a while, especially, in the last 1.5 decades almost. The countries that I'm looking for, especially like Syria, Yemen, Iraq, and Palestine, they have experienced active hostilities and large-scale displacement, placing immense strain on already fragile health system. The large displacement which took from Syria in the last decade, where millions of the people crossed the borders or even displaced inside the country, in the border, mainly to Jordan, Lebanon, and Turkey. Although Turkey is not in the region, but of course, we also had some operations from the Turkey side for the Syria as well in the past. With the recent regime changes in Syria, many of the refugees they actually started going back, returning to Syria, or intend to return under the different intention to return surveys are telling us. And as the data is collected by the DTM intervention of IOM. But the recent situation has actually slowed down the return process as well. Some because of the security concern, but also non-existence of the required infrastructure in the country. Situation in Lebanon is a bit more unique, where there are migrants who are continue to enter from Syria as of now as well, who are scared or intimidated from the current regime actually. And there are people who are returning, or there are migrants, refugees who are returning to Syria from Lebanon. So it's a two-way sort of movement and which is a bit unique in the region. Many of returnees coming to Syria are also passing through Jordan as well in the transiting, and all of these things also poses some challenges, especially when we are talking of TB and HIV and the people who are on medication and how to track and all these things. Basically, in these type of humanitarian settings, and the delivery of the life-saving intervention is becoming more challenging, but more urgent as well. And especially for, as I said, I mean, in the countries supported by the MER project, they are facing specifically humanitarian challenges. There are like we know that even before this conflicts, many of these health systems or the health systems in these countries were not in working to the optimal level. They were I mean, some of them like Lebanon and Jordan historically demonstrated relatively stronger health indicators and better access to care than others. But on the scale, like Yemen was persistently challenged by unstable health infrastructure and poor health outcomes. These actually the disparities across the region also reflect the long-standing structural issues. With some of these countries, they are struggling to maintain the basic service provision even in the time of relative stability. This actually complicates the delivery and monitoring for us for as a TB, HIV, and malaria-related health services. These persistent like insecurity resulted which are in massive displacement, as I said earlier, both with refugees and internally displaced people, which is placing an increasing pressure on the already compromised health systems in these countries. Moreover, I mean, this is not only when we are talking on the security, the major impact is coming from the economic collapse across these many of these countries, especially like when we talk of Lebanon, Syria, and Yemen, and all of them, which has greatly undermined the resilience of the health systems. And their ability to respond to effectively to the needs of the end users. So as much these economies are getting more and more deteriorated, there are subsequent devaluations in currencies. There is widespread inflation. There is surge in poverty, and the governments are struggling to maintain even the most basic health infrastructure. It's very difficult for the systems to maintain the payment and supply for the health workers and the medical supplies, and also maintaining the minimum standards in the health facilities. These fiscal pressures are also being further compounded by widespread unemployment and erosion of the household income, and even people who have access, and even if services are available, there are financial barriers. They can't afford those care as well because of all these economic meltdown. Countries like Syria, Lebanon, Yemen, and Palestine, there is actually an interplay between the economic decline and the ongoing conflict,
Arif,
which accelerate the fragmentation of health systems.
Sorry, Arif, thank you so much. I have to interrupt here due to our schedule, but we will talk about that more in the second round. So really, thank you a lot for your insights into this really, really complex and dynamic situation, especially with refugees coming into one country and then leaving again. I think it's really crucial to understand this also for our discussion, and it gives us a really clear picture of the challenges on the ground. So with that, I'll hand over now to Sasha to guide us into the next part of the discussion. Thank you.
Yes, we would now move to another region, and I'm really happy to welcome Akramul Islam, who is the Senior Director of Health and Humanitarian Crisis Manager at PRAC, an international development organization founded in Bangladesh in 1972. Dear Akramul, you live in Bangladesh, a country that continues to host a large displaced Rohingya populations and frequently experiences several flooding, which have impact on malaria resurgence. Could you please share an overview of the general public health situation in Bangladesh and particularly make a focus on key challenges you face related to internally displaced people, flooding, and the resurgence of malaria? The floor is yours. Thank you. Yeah, I can see that yours. Yes, now it should work.
Yeah, thank you.
Yes, there you go.
So yeah, thank you so much. I will be more sharp to the point. As you told that we host nearly 1.2 million Rohingya refugees in Cox's Bazar, and this is quite a big number of people have been there, and in this settings are very crowded. In few square kilometers, this is population residing. So basic infectious diseases are really common in this ground, which including the tuberculosis, the malaria, the cholera, other infectious diseases, hepatitis, and HIV. So it's quite a hepatitis, HIV is not much, but increasing as well. So it's a large number of population in small places, doesn't have a good, living conditions, have a huge number of public health threats, especially on the infectious diseases, starting from the waterborne, vector-borne, to the other infectious diseases, which is bacteria and other viruses. So that's a big challenge we're facing in the camps. And these camps is also not regulated well because the people can go out and come in. So they also move to the forest area for the livelihoods. So the malaria is not endemic was not endemic in the camp, but now is really big challenge for us because people moving out to the forest and bringing the malaria inside the camps. So having a number of malaria is increasing. Hepatitis C is another one, is increasing in the camp. So it's a number of few challenges, and TB is still there because as a crowded complex, because one room there be 8 people, 9 people sitting. This kind of a common scenario in public health in the camp scenario. While you look into this other the emergencies like in Bangladesh face every year flooding, at least few times in a year. And during the flooding, the people basically displaced from the home. And they usually take the shelters from any temporary shelters where they reside in. And major public health problems in there, the diarrhea, the cholera, the skin diseases, and also the malaria, in some cases in the malaria endemic zones, and also the tuberculosis. So it's infectious diseases basically, and one of the common diseases, along with this, skin diseases. That's the key challenge also in the internet displaced population, because it happens, every year 2 times, 3 times in particular populations. And the third point, many people also after this, displacement happened due to the natural disasters, they still stay in the urban settings or peri-urban settings. So with the very poor living conditions, to continue to grow this, the infectious disease on the ground. So not just everyone going back, because many of these people are also lost their own houses, the lands, they don't have any place to go back. So they decided to stay in the cities or nearby cities where they reside, very crowded places have huge infectious diseases with TB, malaria, HIV, and other infectious diseases, cholera. So this is basically the overall public health scenario. If we look into this displaced population, both internally and also from the Myanmar. So that's another part. Second part, what we also seeing in larger scales, in terms of the sexual reproductive health also is gradually increasing because the violence is also increasing in this setting. So it's a complex setting. It's not just health. You really can't stop with one infectious disease to address on. But the other compounding factors like in gender-based violence happening, the more coming in intimate partners violences. So those are coming also, they're compounding the factors that are also been posing the new challenge on the public health. Well, we really need to address it, because this is also affecting the young girls and women's, and that's all of the big challenge that have, because privacy and dignity is very important for them, which it doesn't maintain in the other places. And that is one big area that we have been seeing. In terms of malaria, if you look into this, malaria it has an impact, particularly is what I said in the Rohingya camps, but also the due to the floods. Basically, we lost many, the IT and the airlines. That was one of the big challenges that we faced. As the washed away, this needs are distributed in, so people are in risk of many more malaria. But more recently, the other vector-borne diseases is growing, like dengue and chikungunya are coming up very frequently. So along with this malaria, this new, this vector-borne disease coming. If you look into this complex, internally displaced or the refugee camps, infectious diseases, vector-borne diseases, gender-based violences, which is basically reproductive health rights issues, and sexual reproductive issues are there. So this is the grossly, basically, you can see in Bangladesh what we're facing in this both urban and Rohingya response situation. So I will stop here. But another one thing I would like to touch on before that, since we have a bordering with India and Myanmar, both these border countries have the high endemic malaria zones. So if we don't have a good collaboration with these border countries, basically we really can't control it. And there is an illegal, movement in these 2-3 countries. People move inside this Myanmar, coming with this drug resistance, or not a drug resistance, but drug resistant TB, but some malaria cases as well as. And also there's from the Indian
I will need
side.
to stop you here. Thank you so much. And I think what we are talking about now is not a crisis, is a disastrous situation. Francesca, I would like to ask you maybe if you have some thoughts or questions or something to add to overview from these two regions.
Thank you very much, and thank you very much, Arif and Akramul. I think we have two different examples, as you said. It's not just regionally, but also the engagement, for instance, with IUM has been quite innovative at the early stage. The Middle East response started as sort of an emergency response to the Syrian displacement of a population. So we had to find the situations following the crisis in Syria, but then evolved into regular grants, and IUM, based on its own experience in emergency settings, but also the presence in different sort of portfolios, have been able to be adaptive to work in Yemen, in the different ways been working in Syria, in a different way has been working in Iraq. So it's been always able to adapt to the country context, and this is what we wanted to share. BRAC has been a strong partnership from the beginning. I think BRAC has been essential in also looking at not only the situation in Bangladesh, and the relationship also with the government is not easy when we look into needs of other population like Rohingya, but they were always able to combine these priorities and needs, and then it's been always essential for us because they were very working at a country level with the key players, with the civil society, with the different sort of partners, also in the refugee camp, in the Rohingya camp, Cox's Bazar, but also now with the movement of a population. So we rely a lot of information coming from the country, being able to adapt our interventions. As Dr. Islam has said, it's also relevant that when you look into this type of a population, needs and problems are always evolving. There's gender-based violence together with the other type of accessibility, gender-related issues of access and equity. So there are multiple, but thanks to the experience of those organizations been working on multi-sectorial intervention, we were able also to address HIV in those settings, TB in those settings, without looking into also from protection angle, from gender-based violence angle. So it's been quite rich. Those are two examples of a partnership in addressing issues in those settings. Thanks.
Absolutely. Thank you so much, Francesco, for summing it up in such a good way. And thank you again, Akramul, Islam, and Arif Hussein for the overview of the situation in your countries and regions. Johanna, over to you.
Yeah, thank you so much. So now we will turn to our second round of questions, focusing on the cooperation with the Global Fund. And I'll start again with Said Arif Hussein. So Arif, you have already outlined some challenges in the Middle East region. And could you please tell us now a bit more about how IOM works together with the Global Fund in response to emergencies and in these challenging operational environments, for example, by using resources from the emergency funds? And also, maybe you can tell us a bit more about problems that IOM currently faces in terms of political or financial supports. And finally, how can strategic partnerships like that with the Global Fund help to address these challenges? You have about 5-6 minutes. Thank you.
Thank you, Joanna, again for your question. I'll try to sum it up in 5-6 minutes. I'll go challenging. But thanks to Francesco, he summed up to how this project started initially as an emergency grant for the Syria response. And then from 2017, it expanded to four countries as a regular grant in the regular grant cycle. Until currently, we are in the fourth cycle at the moment, starting from 2025, beginning of 25 till end of 27. And now we are currently working in 7 countries, naming Iraq, Jordan, Lebanon, Libya, Palestine, Syria, and Yemen. Actually, I will focus more on this partnership, which actually this initiative, which is quite, as Francesco said, quite flexible, thanks to the flexibility of the donor as well. This partnership actually unites the IOM as a partner with Global Fund and other technical agencies like World Health Organization, and also with all the 7 regional governments and the regional and their health disease-based programs, and of course engaging with the local CSOs and NGOs. This partnership is allowing access to critical funding in the last 8 years. For IOM against TB, HIV, and malaria. Till end of the 2024, we have been receiving almost allocated 102 million for this project. Current projects, which is we are in the GC7, the 4th phase of this project, we have been indicated some budget reduction of about 12%. And of course, I'll talk about it, this will pose some challenges. Over the period of these 8 years, the MER has implemented quite a good number of intervention and has demonstrated some good progress, especially when showed the supply of drug and diagnostic for TB, HIV, and malaria, and brought some innovative supply lines systems to especially in countries like Syria and Yemen. And we have been even able to deliver locations which are closed and controlled borders, such as Palestine and northwest of Syria in the past years. We have been supporting the health facilities with improving the labs and diagnostic, procuring the mobile X-ray vans, static X-ray machine, gene expert, lightweight portable X-rays, etc. We have introduced artificial intelligence for X-ray reading in these countries. The integrated community case management of malaria has been introduced in Yemen, and surveillance system has been supported through integrating malaria into the electronic disease early warning system and the district health information system, where TB and HIV malaria surveillance is linked to it. So there's a lot of new thing and innovative interventions have been carried out under this project. New interventions such as self-testing for HIV, for pre and post exposure prophylaxis have been introduced. CSOs are very closely engaged for the outreach, especially testing and treatment services. I don't want to bother you with the data, but actually in these 8 years, this project has MER intervention has reached 200,000 of beneficiaries with treatment, diagnostic, and preventive services, and millions were provided with the long-lasting insecticide treated bed nest. Another support was provided through to the MER under the C19 project, and we have supported the health systems in these countries to a very great extent, and for which are quite, sustained and taken over by the government as well. Of course, the recently women, as all other organizations, are facing mounting challenges related to this current financial and also the political environment, especially the cuts in the official development assistance, which is the global priorities are now shifting, and especially the health funding is shrinking considerably. As I mentioned about, we are also asked to reduce 12% of the current project as well. And these such type of reduction, of course, will pose risk to many or some of the successes that we have gained over, not us, rather the whole system has gained over the years. And this will risk sustaining this momentum as well. We know that the countries that especially MER is working, there is no fiscal space available for the countries to absorb the shock and fill the gap with the domestic financing. We all know what's in Yemen and Syria, Lebanon. They don't actually have this cushion to absorb it. But I believe then in this context, the partnership and collaboration, especially which is established with Global Fund, a long-term resilient partnership is something which will come into interplay. And with the close collaboration with Global Fund and the regional partner, we will try to pool more resources, share knowledge, and advocate for more resources and amplify the impact of every single dollar spent. These are challenging times. We can get through them together if we all work together. So interest of time, I will stop here and hand it back to Anna, and thanks for the patient listening.
Thank you, Arif. Thank you so much. Thank you also to end this round of discussion with highlighting the importance and opportunities that partnership can create, especially now in this challenging time when funding declines. It's super important. And with this, I'll hand over now to Sasha and Akramul for the next round.
Thank you. Akramul, thank you again for your input, and especially mentioning privacy and dignity questions and sexual reproductive health and rights. Now, Bangladesh received emergency funding in 2024 to respond to emergencies caused by the floods and again to support the massive Rohingya displaced population. Both were top-up emergency funds managed by your organization. Please share with us how the emergency funds helped to address the crisis described and how the cooperation with the Global Fund helped to ease the situation. Please.
Thank you. So in Bangladesh, basically the government doesn't allow the country allocation for the Rohingya responses. So historically, we generate funding from the private sector through the Global Fund support. And in the current cycle, we are shortfall of the big amount of resources that we could not really run the responses in the Rohingyas. Then we applied to the Global Fund that if we don't have an emergency fund, we really can't the delivery services, TB, HIV, malaria, hepatitis, whatever this infection is that the Global Fund responsible is, including the alliance, we really can't deliver it. So the Global Fund is so kind enough to get understanding the situation and allowed us basically. So we covered all 3 diseases, both diagnostic, treatment, follow-up supports, and the alliance as well, including some hepatitis C test kits and follow-ups. So that is one of the ways that really helps us for mobilizing resources for the Global Fund, clearly explaining the rationale and the struggle we are facing, because other NGOs other UN agencies doesn't cover these 3 diseases. So they cover the other diseases. So these 3 diseases basically response, we from the beginning, we have been covering as a national program with a partnership with the government, with the support of the Global Fund. But it was not allocated in the envelope. So that was key challenge. So that we addressed through very diligently with the Global Fund support. The next one, the flood. In the last year, we have the 2 major floods. And one flood was very, very severely affected population, and which is covered also thus the malaria endemic zones as well. and also the TB, high endemic zones as well. So when we see the lots of people actually, they lost their houses, so all this mosquito is washed away. People left from the houses, so many TB patients displaced. So what is basically immediately we respond ourselves for immediate responses from our BRAC own resources with other partner support. But what we approach to the Global Fund to basically provide this 3 diseases support so that people who are being affected with the TB can be, back to the home, can be tracked and continue the treatment. So the additional nurse can be procured and distribute to the community. So there will be no, big risk for the malaria and similar to the HIV and hepatitis C. So what we did is basically the basic response of the common, diseases that we did with other donors funding and partnership, but specifically with the 3 diseases, and we support for that. And also one thing we actually added it because of the 2 months, basically we could not work on that. So we really lost around 2 to 3 months to the work loss. So what we did is we scale up with this global additional money interventions to recover the loss that we have it in detection and treatment in the 3 months. So it has 2 sides. One is immediate support and tracking the patients, putting on treatment, distributing the nets, and another one, the recovering from the loss that we have in the last 3 months, because we could not diagnose any TB malaria cases because there's no laboratory functions were there. Technicians were not there because their own houses are also submerged. So that loss, basically, we use those resources to recover those. Of course, with this recovery, the other people also get benefited because when you get these other diseases, we refer to the public health system. So we build relationship with the system, and we also make functional those system with this resources so that we can have a health system functional locally so that we can refer these people to the public health system. So it has a triple effect, actually. Thank you.
Thank you so much. Thank you for this important input again. And now, Francesco, I do not see you, but I hope you are still here with us. And again, I would like to invite you to share with us your thoughts from the Global Fund perspective on what have been said until now, maybe some special strategies to work with described regions and countries, please.
Thank you. And thank you very much again, colleagues from BRAC and IUM. I think the example that was actually mentioned about emergency funding for Bangladesh was quite a result of a collaboration with BRAC in the sense that we understood there was a flooding and impact on the health system. But I mean, the idea is actually that you have already some sort of a complexity around Rohingya population. So we wanted to make sure that any additional sort of events, which is natural events, that might not be impacting negatively also other type of a population. So the proposal coming also from BRAC was actually concrete. So how do we intervene? How do we respond? What is going to be from a static into more dynamic response with mobile clinics to reach the population? So I think this is an example where the Global Fund was able to approve it quickly, but the demand that was actually coming from BRAC in collaboration with the in-country stakeholders. What I would like to add on the point that was raised by Hussein from Middle East Response, for different reasons, it's a region that's been incredibly impacted by crisis, and it's still the case. So we rely a lot on IUM also an ability to engage with the different stakeholders in the region, but also country level, because of ranging from Yemen, Palestine right now, Syria and Lebanon. We had an evolving situations, and we don't even know how would be evolving in the future, but we rely a lot on the ability of engaging with the different stakeholders on a regular basis. We are based in Geneva as a Global Fund. Without that sort of a dialogue or continued dialogue with the humanitarian partners so that IUM is maintaining in the region, we will not be able to understand what's happening. What are the gaps? I remember having also a conversation in the past on the situation in Yemen as well. Yemen is per se a complex country, divided and still with a different sort of area, but IUM was able to work in both areas by engaging with the different sort of stakeholders. So that type of ability was proven to be essential for us to reach populations in need. And that has been quite a success story so far. Thanks.
Thank you very much, Francesco. Thank you for acknowledging the involvement of different stakeholders and especially civil society. And I think it's very important for us. Thank you again, both speakers, Akramul Islam and Arif Hussein, and I'm handing over to Joanna to wrap it up.
Yeah, thank you so much, all of you. I think before we close our session, I would ask each of you panelists to share any final thoughts, including expectations, and also, yeah, in light of the upcoming global fund replenishment. Yeah, please keep it about 1 minute each, 1 to 2 minutes, so that we can stay in our time limit. And I would start with Arif for final thoughts. Thank you.
Thank you, Anna, again. Actually, I think as slightly touched and rightly touched by Francesco, the countries that we are working in, especially the 4 he mentioned, every one of it has a very unique and situation. Every country has its own challenges and different dynamics. Unfortunately, as we know, the economic situation is actually compounding the overall response. Moreover, there are governments which are in transition. Like in Lebanon, we have new government. Syria, the government is in transition, not yet stable. Yemen has 2 governments, and it's very challenging working with them, although we overcome most of those challenges and we have been able to deliver, but all of this require resources. And as I mentioned earlier, they don't have the fiscal space within. So I believe the most important in this in this context is how we are able to establish more and more partnership and bring more stakeholders together into joining this partnership, and to for bringing more complementarities. So I think that is and also some sustained funding till these countries, which are actually, some of them are in like Syria, Lebanon. They are in the process of like regaining their strength in a few years, but still they need this last push of availability of sustained financing during this period. Otherwise, all the gains, as I said, might we might risk them, and the momentum cannot be maintained. Thank you. Thanks again.
Thank you, Arif. I'll hand over to Akramul Islam for final thoughts.
Yeah,
1
thank
to
you.
2 minutes. Thank you.
Yeah, and thank you so much. So I think one key issue is that all the partners basically we require your kind support for upcoming refreshments of resources. As you understand, these countries are being struggling after the USAID fund cuts in public health is mostly affected in many countries. So I think that the investment in global fund is really critical at this point. Otherwise, really, what we gained so far, we lost actually. If we lose it, we really can't gain it again actually. So I think that is one of the key messages that I would like to request all the partners, both bilateral, private sectors, philanthropies, to put additional resources so that we can maintain this momentum and improve the programs and sustain the programs. The second part, what I would like also to say is many countries, in uncertainty is increasing, globally, emergencies are everywhere, So we may not have this kind of a domestic financing that we're seeing may not available everywhere. So lots of money also being going to drain to this uncertain, addressing the uncertainty, the complexity that is being globally happening. So I think we also need to take care about that in a considerations. Even we are asking government to have a domestic financing may not be possible for many countries. As for Bangladesh, I can see this is we're having a transitional government, so it will take maybe another year time to come and settle it out. So we really need support for this additional resources, and of course the uncertainty is there. And overall health funding is decreases. So this maybe in the upcoming resources, if we can mobilize more resources for the global fund proved actually how to spend it, how to make an impact. And that's, we need to actually put that in agenda, for the further investment and demonstrate the impact in 3 diseases. Of course, you can also include systems and resilience maybe will be added in the future in the climate vulnerability and other crises are coming in. So it's one of these areas, this emergency funding, maybe on the climate funding, maybe added would be given added value for countries to continue, and the loss, to sustain, and then also the regain from the loss that we have it. Thank you so much, from my side. So I really appreciate your session, and we ask sincerely for our partners to support.
Thank you, Akramul, also for your final thoughts and insights. And I'll also hand over to Francesco for final thoughts. Thank you, Francesco.
Thank you very much. And I think Hussein and Islam said it all, in the sense that we are moving into financial tensions, and then this is going to be impacting also our ability to reach populations in need. Because traditionally we look into the development funding being reduced, but also the humanitarian funding has been equally reduced, and this is really impacting from a different angles our ability to intervene. Nonetheless, the Global Fund remains highly committed to provide enough flexibility and agility to intervene in those settings. The emergency funding will be always there, will be prioritized. We always would like to mainstream and try to encourage a country to mainstream interventions towards populations in need, like refugees, migrants, and IDPs. This is going to remain. For us, it's still a priority if we want to fight HIV, TB, and malaria. It's not that we are going to be ignoring this population. We would like to make sure that at country level also will be included into the country dialogue and the discussions about next funding allocations. We will make sure that regardless of the funding scenarios, we're going to be also encourage a country to continue these discussions with the humanitarian partners, so to focus also on areas that are not accessible and not privileged populations. So we would like to maintain this agenda very clear regardless of the financial tensions. But I also appreciated the support from you on this call. From a Global Fund perspective, we really appreciated the efforts for the replenishment and the support of Germany on this. Thank you very much.
Yeah, thank you everyone for your participation and closing remarks. I hand over to Tanya for the closing of this session. Tanya, to you.
Yeah, thank you so much. So just to briefly wrap it up, we had a rich and insightful discussion on the Global Fund's role in responding to emergencies, and we learned how the response mechanism worked, and also we got valuable insights from the Middle East region and also from Bangladesh, and hearing how emergency funding has made a real difference on the ground there. And also thanks a lot for sharing your last thoughts. And of course, a huge thank you to all of you for joining today, and a special thanks to our fantastic speakers, Arif, Akramul, and Francesco. Also, thanks a lot to all participants for your time and for your interest. And of course, also a big thank you to everyone behind the scenes who helped to make this session happen today. And as mentioned earlier, we would like to take a group photo. So yeah, a screenshot of the participants. So if you would like to be in it, so please turn on your camera. And Marvin is going to take the screenshot.
Thank you, thank you, thank you. You can all brush up and take another shot of Kayal. I'm going to give it just 1 second, so that for all those who would like to, of course, only those, I'm going to make a screenshot. I'm going to count you down. Then you make your eyes wide open. 3, 2, 1. Ooh, Peter, I even got your little, no, that one I messed up. Sorry, I have to go one more time. This is Marvin trying to command the internet. One more. And I think this time it actually worked, just to be sure. The thing is, I'm always never looking at the screen when I'm making the screenshot. That's not the wisest of moves. Thanks for your patience, but now we are done. Thank you so much, folks.
Thank you so much.
Have a wonderful day.
Thank
Bye-bye.
you.
Bye.
Bye.
Thank you. Bye.
Bye. Thank you.